The Buddhist Therapy by Venerable Rung Ruang Papas Saro, Dr. Rung Ruang Lim Chupatipa. The seclusion of mind with mindfulness. Learning to recognize thoughts as merely thoughts, not reality. Negative thoughts can restrict our ability to relate differently to experience. Recognizing when, in everyday life, negative emotions and reactions trigger doing mode, and learning how to disengage from that mode and enter being mode, providing patients with additional coping strategies and a range of options to respond effectively to negative emotions, integrating all these skills through continued mindfulness practice to stay well and prevent future relapse. Step 1.1. Therapy Introduction. The therapy starts with learning the truths of nature through the material contents in previous videos. This is an introduction to the practice of mindfulness and recognition, including the Buddhist science, the science of mind, the realm of thinking, Dharma to contain and to abandon unwholesome thought, mindfulness and concentration. Having a good understanding of the Dharma or the knowledge about the nature will be very helpful to cope with whatsoever happening in the world. After learning the theory as background in living, then we will practice in introspective learning with the real experience of the Dharma to gain cognition to resolve any arising problem in life. Step 1.2. Mindfulness Initialization. The focus of this step is to learn on how to establish mindfulness. This is a basis of the therapy because we will make use of mindfulness to monitor mind conditions and to be aware of what is happening inside the mind. There are several ways to practice mindfulness establishment in everyday events as follows. Establishing mindfulness while walking up and down. That is, when walking at the time of foot stepping on ground, the mind will be aware of the contacting, then to be aware of the feeling after bodily contact at the sense base. This awareness arises and fades away quickly, and then when making a next step forward, a new awareness of bodily contact will arise and fade away again. As we can see, after walking up and down for a while, we will develop a skill of being aware of bodily contact, and the mind becomes awakened to sense whatsoever stimulus arriving through the sense bases. Establishing mindfulness to be aware of bodily movements in various positions. That is, when making body movement to any position such as standing, bending, twisting, sighting, laying down, etc., then to be aware of the body movement in such particular position. By doing so, we have incorporated everyday life activities with mindfulness, saying establishing mindfulness at all times. Mindfulness breathing. Since as long as being alive, we have to breath to get oxygen into our lung, therefore breathing is common activity to human being. In this situation, the Buddha introduced a practice to establish mindfulness whenever taking a breath. That is, when breathing in, then to be aware of breathing in, and when breathing out, then to be aware of breathing out, respectively. By performing mindfulness breathing, while breathing, then we take an opportunity to observe mind conditions to see what the mind really is. Do we feel happy or sad, kindness or greedy, love or hatred, calm or frustration, etc.? The goal of mindfulness establishment is to develop a capability to make use of mindfulness to be aware of what is happening in the mind conditions, and then apply the mindfulness to monitor the mind and its functions. Realizing that the mind is always changing from one condition to another condition. That is, the mind is never stand still, and we will proceed the mind study on its characteristics, functions, and processing. Step 1.3. Mindfulness in the present moment. Next, we will sharpen the mindfulness to focus on what is happening in the present moment. Establishing mindfulness to stay present to widen the perspective on how they relate to experiences. By having the mind to stay in the present moment will pull the mind not to wander around something without clear direction, especially when thinking about negative events in the past for so many times, and the mind get fatigued and tired, so-called depression, or worrying about some bad events that may happen in the future for so many times, and the mind get excited and nervous, so-called anxiety. By having a careful investigation of the depression and anxiety, we can realize that both of them share a common characteristic of unwholesome thought. The difference is that depression is an unwholesome thought of something in the past, while anxiety is an unwholesome thought of something in the future. The Buddha suggested to have a mindfulness in the present moment, to pull the mind out from trapping in the unwholesome thoughts of depression of the past and exciting from the anxiety of the future as follows.
One should neither run back into what happened in the past, nor be afraid of what is going to happen in the future. Whatsoever happened is already happened, and it arises and fades away. It is impossible to change the past. Whatsoever to happen in the future is dependently on a certain cause and effect. If do it right, then the outcome will be right as well. Especially at this moment, nothing is happening yet. It is important to realize that whatsoever happening in the mind, it arises and eventually fades away. What a depression and an anxiety are about is just an object of consciousness happening inside the mind. Those who has mindfulness in the present moment all day and night will have nothing to be worried about and to be afraid of. We should have a mindfulness in the present moment because when the mind has received either a stimulus of external mental phenomenon from sense bases or an internal formulated mental phenomenon, if we do not think of whatsoever has happened in the past or of whatsoever may happen in the future, and then the mind will not be bothered with any matter anymore. That is, we should not think of whatsoever had happened in the past, and do not run forward into the expectation of whatsoever may happen in the future, but we should firmly keep the mind to be steadied in the present moment only, then the mind will not be afraid of anything. And the mind will abandon the 5 aggregates subject to cling.
Step 1.4. The knowledge that thoughts are just unreal, not fact. The virtual reality of meta-world is not real. What being in thoughts are our own imaginations. We create them from the process of volitional formations. The feeling associated with thoughts are also our own imaginations. This is a hard lesson to learn that thoughts are not facts. Usually, we are dominated by unwholesome thoughts of sensual desire, ill will, depression, anxiety, and doubt that lead to evil doing with greed, hatred, and delusion. In Buddhism, thinking is a mind processing that creates an imaginary world. An imagination is unreal. In fact, there is nothing wrong with the imaginary, but the unwholesome one is very serious because not only that it is not real, but also it is unwholesome, causing problem to the one who occupies it. How come we let the unreal thing to harm our life? During the mind processing, the complexity of thought depends on how far we add information from memories into the volitional formations. It is just like many shells of onion putting up layer by each round of the process of dependent origination. That is, in each round of the process of dependent origination, a new object of consciousness with addition more complexity is added to the subject of thought. And the effort to establish mindfulness to abandon arising unwholesome thought is just like peeling off each layer of onion shells one by one. Definitely, this is a time-consuming with great effort before dwelling to the inner core of the subconscious level of the initial thought, where is the origin of thinking process in the first jhana. The initial thought is something very critical, like the creator of imaginary world. And after establishing mindfulness to abandon the initial thought by liberated thinking of proper dharma, then we can see the mind clearly of what it really is, and then proceed to perform an insight observation to see the process of dependent origination. Step 1.5. The master of the courses of thought. While monitoring the mind, if we find that the mind is unwholesome, then apply a proper dharma to abandon such unwholesome thought away. For examples, if we are obsessed with sensual desire, to someone then realizing the dharma that nothing will last forever, all sensual happiness in the thought will cease anyway, so that the obsession is contained and abandoned. If we compulsively hate to someone, then realizing the dharma that by the law of karma, those who does evil doing will receive evil doing in return anyway, so that the compulsive disorder is contained and abandoned. If we are in depression or anxiety, then establishing mindfulness in the present moment to pull the mind away from depression and anxiety. The success in resolving mental illness is based on a simple tactic that by establishing mindfulness to bring in a proper dharma, the truth of life in nature, to abandon arising unwholesome activities and matters along the courses of thought, then the associated unwholesome thought of the 5 lower fetters, namely sensual desire, ill will, depression, anxiety, and doubt are cleansed out. The Buddha introduced a mindfulness technique called Yonaso Manasikara, which is based on making use of mindfulness to abandon unwholesome in order to keep the mind to be wholesome throughout the mind processing at all times as follows.
I teach you on how to abandon any kind of arising unwholesomeness within the mind, because when the mind is unwholesomeness, then the mind will be struggling, non-internally steadied, restless typically with desire and lust. In addition, we have to pull out the mind from this trouble as soon as possible before it will burst out into action of wrongdoing. This can be done by having mindfulness with careful attention on something wholesome in order to abandon that unwholesomeness, so that the mind will become internally steadied, composed, unified, and concentrated in peace. This is the way to keep the mind be wholesome at all times.
After being able to abandon all the 5 lower fetters, namely sensual desire, ill will, depression, anxiety, and doubt, then the mind becomes seclusion in peace. The strong emotion of sensual desire or ill will cause obsessive or compulsive disorder in mental illness. Depression and anxiety are identical to depression and anxiety of mental illness. The doubt with delusion is sort of psychosis. An attention deficit is that the mind is not concentrated. Whenever the mind experiencing along the courses or the pathway of unwholesome thoughts, the mindfulness will bring in a proper dharma to counter the arising unwholesome event, and this is a reason the person is a master of the courses of thought. What we can benefit the most from this practice is to learn how to bring in a proper dharma to handle a particular type of unwholesome thought. For examples, when being in obsession with the beauty or body of opposite sex, then establishing mindfulness to bring the truth that everyone must be aging, getting old and eventually dead anyway. Therefore what we perceive as beauty will not last forever. The obsession towards such a person will be contained. Not to take any compulsive action in response. On the other hand, when thinking of someone who we hate with anger, in this case we establish mindfulness and let the law of karma to work by itself without our involvement. That is, those who do bad things will get bad things in return, and then we should not take any compulsive action in response. Similarly, when being depression or anxieties, then establishing mindfulness in the present moment, then the mind will be pulled out from any troubling unwholesome thought, and then the depression and the anxiety are resolved. Moreover, by knowing the truths of Dharma, nature, the mind will not be confused by any doubt. Typically, although we may have learned the theory of Dharma, nature, but we have to practice to establish mindfulness to have experiences in bringing Dharma into actions to resolve all kinds of mental health problems of the 5 lower fetters to make a cognitive development. And this is the reason why the words mindfulness and cognition in the mindfulness cognitive therapy come from. The Buddha called a person who becomes successful in containing the thought a master of the courses of thought as follows.
If, while he is giving attention to stilling the thought formation of those thoughts, there still arise in him evil, unwholesome thoughts connected with desire, hate, and delusion, then he should beat down, constrain, and crush mind with mind. He beats down, constrains, and crushes mind with mind, then any evil, unwholesome thoughts connected with desire, hate, and delusion are abandoned in him and subside. With their abandoning, his mind becomes internally steadied, composed, unified, and concentrated. Just as a strong man might seize a weaker man by the head or shoulders and beat him down, constrain him, and crush him, so too, when a monk beats down, constrains, and crushes mind with mind. Monks, when a monk is giving attention to some sign, and owing to that sign there arise in him evil, unwholesome thoughts connected with desire, hate, and delusion, then when he gives attention to some other sign connected with what is wholesome, any such evil, unwholesome thoughts are examined on the danger in those thoughts, then these unwholesome thoughts are abandoned in him and subside, and with their abandoning his mind becomes internally steadied, composed, unified, and concentrated. When he tries to forget those thoughts and does not give attention to them, he beats down, constrains, and crushes mind with mind. Any such evil, unwholesome thoughts are abandoned in him and subside, and with their abandoning, his mind becomes internally steadied, composed, unified, and concentrated. This is then called a master of the courses of thought. He will think whatever thought he wishes to think, and he will not think any thought that he does not wish to think. He has severed craving, flung off the fetters, and with the complete penetration of conceit he has made an end of suffering. That is what the Blessed One said. The monks were satisfied and delighted in the Blessed One's words.
In this first part of therapy, the focus is on making use of mindfulness to maneuver the mind, especially thoughts to be wholesome after abandoning all unwholesome thoughts of the 5 lower fetters. Then a person becomes a master of the courses of thought, and then the mind becomes wholesome with internally steadied, composed, unified, and concentrated. Step 1.6. The serenity to be in seclusion with peace. That is, after all the unwholesome thoughts of the 5 lower fetters are abandoned, then the mind becomes internally steadied, composed, unified, and concentrated. At this time, the mind will dwell to the initial thought in the right concentration, then establish mindfulness to bring in a proper dharma of liberated thinking to abandon this initial thought, and then the mind will be in rapture, then be calm in peace with seclusion. In this circumstance, the mindfulness will be developed to be purified mindfulness with equanimity. This is a kind of mindfulness for performing an insight observation. The right concentration is one of a critical part of mind development to sharpen the quality of mindfulness to be able to observe the mind clearly. In Buddhism, the right concentration is a special condition when the mind dwells to jhana, which is composed of 4 levels of development as follows.
And what, monks, is right concentration? Here, monks, secluded from sensual pleasures, secluded from unwholesome states, a monk enters and dwells in the first jhana, which is accompanied by thought and examination, with rapture and happiness born of seclusion. With the subsiding of thought and examination, he enters and dwells in the second jhana, which has internal confidence and unification of mind, is without thought and examination, and has rapture and happiness born of concentration. With the fading away as well of rapture, he dwells equanimous and mindful and clearly comprehending, he experiences happiness with the body. He enters and dwells in the third jhana, of which the noble ones declare. He is equanimous, mindful, one who dwells happily. With the abandoning of pleasure and pain, and with the previous passing away of joy and dejection, he enters and dwells in the fourth jhana, which is neither painful nor pleasant and includes the purification of mindfulness by equanimity. This is called right concentration.
The mindfulness will lead the mind to be concentrated, enhancing the mindfulness to become cognitive adaptability when exploring inside the mind during the introspective learning. Typically, the mindfulness-based cognitive therapy will end here at the first part of Buddhist practice, because by having mindfulness to monitor mind conditions, when encountering with something either present or non-present, then holding the mind not to overreact to the feeling, and then the mind will not be obsession-compulsive disorder. In addition, when detecting that the mind is in depression or anxiety, then by establishing mindfulness in the present moment, the mind will be pulled off from depression disorder, anxiety disorders. Moreover, when being able to abandon an arising unwholesome thought, then the mind will be internally steadied, composed, unified, and concentration, and then the mind is calm with no problem of attention deficit and hyperactivity disorder, ADHD, and bipolar disorder. The seclusion with happiness will bring back the person to society with no dissociative disorders. In the case of post-traumatic stress disorder, PTSD, and psychosis, the cognition that even thoughts are not real, therefore the occurrence of the post-traumatic stress is also not real. Moreover, the sense objects perceived through the sense bases in psychosis are also not real. Patient must receive a very intensive care to realize what is real from delusion by establishing mindfulness to pull the mind to be in the present moment to realize the reality which is different from delusive imaginations. In Buddhism, after correcting the thinking process up to the circumstance whenever the initial thought may begin, then it is abandoned by liberated thinking, and then the mind will dwell into the absorption level, saying the subconsciousness level in the very early stages of mind processing when encountering with the world. This part of mind exploration for introspective learning is called the insight observation to gain knowledge on the truths of life within nature.